I'm Chandni Pattni, and I am an advanced therapeutic gastroenterologist, and I've been at Humber for a month. My gastroenterology practice on a day-to-day basis breaks down into inpatient and outpatient time. And so my outpatient time is really seeing my wonderful patients in clinic, seeing consultations and follow-ups. And then I do my wide range of procedures, including endoscopy, colonoscopy, endoscopic ultrasound, and our biliary procedures, ERCP, here at the hospital in the endoscopy unit. And then of course, the inpatient service aspect, which I do here covering gastroenterology for the wonderful Humber population. I would say it really does come down to my upbringing. I had a really great childhood and parents that sort of helped to steer me in like the right direction. But I would say what really clinched it, particularly with gastroenterology. My father had a blockage of his bile duct. This was about 15 years ago now. And you know, I got really into trying to understand what happened to him, trying to understand the procedures that were done to help him, and the concerns surrounding if this could be a cancer. And you know, he went through a lot during that time, and I always thought, is there something that could have been done to ease his process? Could there have been something that was less invasive? And that kind of, all those questions and the diligence down that path, I think brought me over to specifically actually advanced therapeutic gastroenterology. I mean, as a whole, I find it fulfilling. I think every day I wake up and I'm actually excited to come into work and to do what I do. I think it's a combination of the patients that we see getting to affect a difference, because GI problems are honestly everywhere and everyone has them, so you really do feel like you're making a difference. And then it also comes down to the procedures. I love working with my hands. I love really every aspect of endoscopy. And no matter how exhausted or overworked sometimes we feel, I feel like awake and alive when I'm in the endoscopy unit. And so that's what brought me here. Humber actually provided kind of the perfect balance for me in terms of what I wanted for my career. So it's both a community hospital with an academic flair, and you can sort of combine both aspects in your career. And so I was really interested in education, and so I know we're able to teach here and have residents, and so I'm really excited to sort of pay it forward in that standpoint. And then the alternate aspect of such a wide and diverse variety of pathology, the volume, and also the ability to be able to perform the sort of specialized procedures that I received extra training in, kind of all together, made Humber really the perfect fit. I would say it sort of breaks down into opportunity, education, and mentorship. The division here at Humber is really so experienced, and there's so much for someone new into the profession to learn from going forward in my career. So there's a lot of room for mentorship, and really the camaraderie between the group and the support and generosity with their time has been amazing coming into the division. I would say in terms of opportunity, with Humber's connections with the University of Toronto and with Queen's, there's so much opportunity to build our name in terms of education, and also to bring Humber even further into the therapeutic and advanced endoscopy space. We really have the building blocks here to expand on so much, get into therapeutic EUS, get into advanced lesion resection, so much that we can bring to our Humber population that I think will really optimize their care.